Hello, everyone. I'm Dr. Shirley Christian, and this is Dr. Lisa Hill. We're with Capital Area Pediatrics, here to tell you about CAP's new multi-specialty clinic. So, Dr. Hill, tell us, what is the new multi-specialty clinic?
The multi-specialty clinic is CAP's new venture. Through this clinic, we're hoping to address three of the most common chronic medical conditions that children face: obesity, constipation, and headaches. And my personal interest is obesity medicine.
Okay. Now, tell us, how did you become interested in pediatric obesity?
Yeah, my interest was really born out of personal experience. I was a child who carried some extra weight and just remember some of the challenges in going through the healthcare system as an overweight child. I loved my pediatrician. Dr. Hollander was wonderful, but certainly he did not have the sensitivity that I think that parents would expect in talking to me and my mom as we tried to navigate how to deal with carrying extra weight as a child. But my interest really was cemented as I just got frustrated year after year working with children, seeing them for their annual well visits and seeing a child who carried extra weight and just in the confines of the time constraints during an annual well visit, just not having enough time to fully address their concerns and really providing them with a plan that would affect some meaningful change.
Now, tell us about the recent training that you completed.
Well, as with all CAP providers, I'm board certified in pediatric medicine, but this past year I took some time to do some additional learning about obesity medicine in general. And there is a board specialty, obesity medicine, and I took that exam this past fall. And so now I'm currently board certified in obesity medicine.
Congratulations.
Oh,
That's
thank you. Thank
great.
you. Thank you.
What age child will you see at the clinic?
I will see all ages. There are two ways to see to get an appointment, and so if a parent has a concern about their child's weight, you can self referral and self schedule an appointment. But also, there are CAP providers who may be seeing you for your regular visits, and they may have concerns, and they may refer you to the clinic to see me as well. But I will see all ages.
And what can families expect when they come to that first clinic visit?
Yeah, the first visit will be about 60 minutes long, and I really want to make sure that we can make the use of that hour. It's so rare in general pediatrics that you have an hour to spend with your patient. So prior to the visit, I will probably reach out in some form and have some screening forms that will better help me understand if there are any mood issues, attention focus issues, get a better sense of the family history, the prenatal history, anything that might influence our work together. And during that first visit, we'll really dive into what goals you might have, what goals the child may have for our work together, and hopefully at the end of the visit, be able to come up collaboratively with some strategies and some goals and some next steps that we can take to see if we can affect some meaningful change.
And how often will patients need to be seen?
I really would like to see patients every month. I think there's a level of accountability and it keeps this work forefront in your mind if we're seeing each other every month. Also, it's important to know that what we put in place in month one, it might be effective in the beginning, but what's effective in month one might not be effective in month five. So it's important to kind of have continuous contact just to make sure that what we are doing is working.
And lastly, can you tell us your thoughts on the weight loss drugs available on the market?
I think that they can be an important piece of the puzzle. It's a tool. Unfortunately, this work is a multi-pronged approach, and so the foundation of our work together will still be lifestyle intervention, nutrition, environmental control, physical movement. And I think I would look at medication as a way to make those things more accessible, more feasible. They can't work in isolation, but they can be an important piece of the puzzle. And I do prescribe them, and I think where appropriate, they can be a life changer.
Well, this is great. Thank you, Dr. Hill, for being here today and sharing your thoughts on the new multi specialty clinic And we look forward to hearing more about the clinic over the next few months.
We're really excited, and I hope if this sounds like something that you'd be interested in, you reach out and we'll be happy to start seeing you in May.